As we head into another enrollment season, one of the biggest questions people have is whether Medicare Advantage plans are really worth it. You've probably seen countless commercials talking about all the extra benefits you can get with Medicare Advantage, things like dental, vision, hearing, gym memberships, and even grocery cards. It sounds great, right? But there's always a flip side. Today, we're going to look at both sides of the story, the pros and cons of Medicare Advantage, so by the end of this video, you'll have a clear understanding of whether it's the right choice for you or not. Now, before diving into details, let's start with what Medicare Advantage actually is. Medicare Advantage, also called Part C, is an all-in-one alternative to original Medicare. Instead of getting your Part A, hospital insurance, and Part B, medical insurance, directly from the federal government, you get your coverage through a private insurance company that's approved by Medicare. Most plans also include prescription drug coverage, Part D, and many add extra benefits that original Medicare doesn't offer. So essentially, it bundles everything together, hospital, medical, and drug coverage, and then sometimes adds even more perks. That's a big reason why more than half of Medicare beneficiaries now choose an Advantage plan instead of sticking with original Medicare. Let's start with the positive side first, the pros that make Medicare Advantage so attractive. One of the biggest advantages is convenience. With Medicare Advantage, you have one card, one plan, and one point of contact for almost everything. You don't have to juggle different parts or separate prescription drug plans like you do with original Medicare and a Medigap policy. For many people, especially those who prefer simplicity and predictability, that's a big win. Another major benefit is the additional coverage you can get. Unlike original Medicare, most Advantage plans include things like dental cleanings, vision exams, hearing aids, gym memberships, transportation to medical appointments, and even over-the-counter allowances or grocery benefits. These extras can make a real difference in quality of life, especially for retirees living on a fixed income. If you need glasses, hearing aids, or regular dental care, those costs can add up fast. Medicare Advantage plans that include these benefits can save you hundreds of dollars a year. Then there's the matter of cost predictability. While original Medicare generally covers about 80% of approved medical costs, you're responsible for the rest unless you buy a Medigap supplement. With Medicare Advantage, many plans have low or even $0 monthly premiums, and they all have an annual out-of-pocket maximum. That means once you hit that limit, the plan pays 100% for covered services for the rest of the year. This can give you a sense of financial protection that original Medicare doesn't have, because original Medicare technically has no cap, your expenses could keep adding up. Another pro is that many Advantage plans now offer care coordination and disease management programs. These are designed to help people with chronic conditions, like diabetes, heart disease, or COPD, manage their care better. You often have access to a network of doctors who communicate with each other, helping to reduce duplicate tests or conflicting treatments. For people who like the idea of having their care more organized under one umbrella, this can be very helpful. Medicare Advantage plans can also be a great option for people who don't travel much and are happy staying within a specific network of doctors and hospitals. Many plans, especially health maintenance organizations, HMOs, keep costs down by using a specific network. If your favorite doctors and hospitals are in-network, you can save money and get coordinated care without having to deal with unexpected bills. Now, all of that sounds good, but here's where the other side comes in. The truth is, Medicare Advantage isn't perfect, and it's not for everyone. One of the biggest drawbacks is network limitations. With original Medicare, you can see almost any doctor or specialist in the US who accepts Medicare, and that's most of them. With Medicare Advantage, however, you're usually limited to a network of providers. If you go outside that network, your costs could be much higher, or the plan might not pay at all, depending on the type of plan you have. For people who travel often or split time between states, that can be a serious disadvantage. Another downside is that Medicare Advantage plans can change every year. The premiums, copays, deductibles, and even the doctors and hospitals in the network can shift from one year to the next. That means you have to review your plan every single annual enrollment period, from October 15th to December 7th, to make sure it still fits your needs. Many people don't realize that until they show up for an appointment and discover their doctor is no longer covered. Then there's the issue of prior authorization. This is something many Advantage Plan members find frustrating. Before getting certain procedures, tests, or even medications, your doctor has to get approval from the insurance company first. It's essentially the company saying, "Yes, we agree this is medically necessary." This can delay care, create extra paperwork, and sometimes lead to denials. With Original Medicare, you rarely run into this issue. Your doctor decides what's needed, and Medicare generally pays according to its guidelines. Cost sharing is another con that people don't always see right away. Yes, the premiums can be very low, but Medicare Advantage plans often have copays for almost every service. Doctor visits, lab tests, outpatient procedures, hospital stays, they all come with different costs. If you have frequent medical needs or several chronic conditions, these copays can add up quickly. While there's an annual out-of-pocket maximum, many people still find that they spend more than expected during the year, especially if their health changes suddenly. Another challenge comes if you ever want to switch back from Medicare Advantage to Original Medicare later. When you first turn 65 and join Medicare, you have a guaranteed right to buy a Medigap plan with no health questions asked. But if you start with Medicare Advantage and later decide to switch back, in most states you'll have to go through medical underwriting to get a Medigap plan. That means the insurance company can deny your application or charge you more based on pre-existing conditions. So, for people who think they might want to go back to Original Medicare someday, this is an important consideration. Emergency coverage is another gray area. Medicare Advantage plans are required to cover emergency and urgent care anywhere in the U.S., but getting follow-up care or non-emergency treatment outside your plan's service area can be difficult. If you travel frequently or spend time in multiple states, you could end up paying more out of pocket for care away from home. Another subtle but important issue is plan complexity. There are hundreds of Medicare Advantage plans on the market, and each one has its own set of copays, deductibles, and covered services. For someone new to Medicare, it can be overwhelming to compare all the details. Even people who've been enrolled for years sometimes miss plan changes that impact their coverage. That's why reviewing your plan annually and reading the fine print is so important. Finally, while Advantage plans can offer lots of extra perks like dental, vision, or fitness programs, those benefits can vary a lot between plans, and they might not be as comprehensive as people think. For example, a plan might advertise dental coverage, but it may only cover basic cleanings and X-rays, not major services like crowns or dentures. Or it might include vision benefits but limit you to certain providers. So, while those extras sound appealing, it's important to check the details before assuming everything is fully covered. In the end, whether Medicare Advantage is right for you really depends on your personal health, lifestyle, and priorities. If you're generally healthy, like having one plan to manage everything, and your doctors are in-network, an Advantage plan can be a very cost-effective and convenient choice. But if you want the freedom to see any doctor, travel often, or prefer to avoid network restrictions and prior authorizations, Original Medicare with a Medigap plan might fit you better. It's also important to remember that no single plan is the best for everyone. What matters is finding the plan that fits you. Take time to look at your prescriptions, preferred doctors, and upcoming medical needs. Compare plans side by side during the annual enrollment period, and don't just focus on the premium. Check out the copays, the maximum out-of-pocket limit, and what's actually covered. If you find the process confusing, there are licensed Medicare advisors who can help you compare options for free. They don't charge you for their help, and they can walk you through what each plan covers so you can make an informed decision. As we move into 2026, Medicare Advantage plans continue to grow and evolve. Many insurers are expanding their networks, adding better drug coverage, and improving supplemental benefits. The government is also keeping a closer eye on these plans to ensure they deliver fair and reliable service. That's a good thing for everyone. Competition means better choices and better care. So, whether you decide to go with Medicare Advantage or stick with Original Medicare, the key is to stay informed, review your options every year, and make sure your healthcare plan still meets your needs as they change. Remember, what worked for you last year might not be the best fit next year, and that's okay. Medicare gives you the flexibility to change, as long as you take the time to understand your options. And if you've made it this far into the video, thank you for watching. You're already doing the most important thing, learning before you make a decision. Make sure to like this video, subscribe to the channel, and turn on notifications so you don't miss our next Medicare update. There's always something new coming, and being prepared is the best way to protect your health and your wallet.